After listening to Keith Miller's talk, I want to just make one other comment about the program project meetings that we had. And that is, as mentioned, he would organize these extraordinary scientists to come, sometimes with relatively tangential links to anesthetic mechanisms. People like Christoph Koch, who was down at Caltech, would come and talk about thoughts about mechanisms of perception, mechanisms of consciousness. And I would sit in the audience at these meetings and have no clue what these people were talking about, and struggle to keep up with the lectures. And at the end of each lecture, and Keith, you can, where are you here? You can tell me whether or not this is your recollection. At the end of each lecture, Ted would ask incredibly insightful, incisive questions. He understood these talks, which I was clueless what was going on. He would ask sort of the key question, what about this? And I'm like, did we even talk about that? And his knowledge of the anesthetic literature was encyclopedic. You could never talk about the mechanisms or Max studies or all of these things without Ted knowing literally every reference. And correct me if I'm wrong, Keith, but
couldn't get away with anything.
Yeah, he wouldn't let you get away because he knew it. He knew this stuff and he followed this stuff. So the level of fundamental brilliance, we talked about some of the other things, but he was an unbelievably quick mind, and you could see it in these meetings.
I mean, I think, we haven't talked about what anesthesia is. It's a happy surgeon, I guess, but there's lots of stuff going on when you're being anesthetized. And I think one of the interesting Ted was doing at the end, he had like Fanslow up from UCLA. They were trying to sort of figure out all the components that you could think of in anesthesia, recollection, no sensibility, and so on. He was trying to tease these apart because probably each of those behavioral endpoints has their own pharmacology, and if we could understand them, we could make much better anesthetics. Instead of just swatting the whole thing, we might be able to target the things that are important and not get the unimportant things like the ability to breathe or your heart to beat and things like that. So I think part of the reason he could do that was he had this sort of basic feeling about physiology and what's going on. And if you stick with physiology, you're always okay. I mean, and I think that was part of it, but you're right. I mean, he just was so interested in things. I think he only invited those people because he read what they'd done, right? Which we hadn't. But the amazing thing was they came to this little room at UCSF with a bunch of funny people who studied anesthetics and gave talks. And I think that's something that most of us could not do. I mean, he could persuade people to come and do that.
I'm Philippa Newfield. I was on the faculty in the late 70s, early 80s. Some of my residents are here. It's a relationship that lives forever between attending and residents. But I was then one of the attendings who was anesthetizing the patient with my residents while these studies were ongoing. And the insight I think we got courtesy of Dr. Miller is evidence of Dr. Eager's humanitarianism, because what I had never known but for these emails was that he signed his letters, "Be well." He didn't sign it best, he didn't sign it in friendship. "Be well" is a direct translation from the Yiddish "sei gesund." And that's what you wish for everybody. And all along, in all of Ted's interactions with everybody, that was what he wished for people, which I really never knew until Dr. Miller showed some of those really basic, really important emails. So that's really what we'll take away about Dr. Eager. He wished everyone well, directly from his own heritage, sei gesund. Thank you.
Thank you.
I just want to add a thank you to you, Michael, for bringing up work, because work was incredibly important to Ted. He started it over 50 years ago and supported it, and it has thrived and grown. It's a vibrant, robust meeting. now annually and run by the residents, as you said. And it's a wonderful ongoing memory of him.
I'd rather get some new ones than the repeats, but okay.
This is a story I just recalled when you were speaking about work. Work, as you commented, was one run by the residents. And I was the chief resident in 1965, and as a consequence, chairing work was a responsibility that I had. And you were expected to invite a distinguished speaker for one of the luncheon sessions. And so I invited Melvin Belli, a well-known trial attorney, who accepted. Actually, Stu Cullen helped with achieve that invitation. And he accepted to come be the luncheon speaker. I was sitting on the podium, and we were having lunch, and Belli hadn't showed up. And I was getting increasingly anxious, as is known to happen to me. And I received a note. And the note was handwritten, and it said, "Dear Dr. Seidman, terribly sorry. Something has come up, and I'll be unable to attend the lunch." And I was just crestfallen. It was just awful. And I looked down in the audience, and at the table in front, Skip Way was sitting next to Phil Larson. And the two of them are watching me and having just the jolliest old time laughing. And at that moment, Melvin Belli walked in behind. And of course, they had just sent me this horrible note. But that was the kind of thing that occurred at the work meeting, and they were in fact wonderful. When I was first-year resident, was the first year that the meeting was held in San Francisco on the 13th floor of the CVRI, and the meeting expanded. The next year was at Stanford, and it expanded to the point where it now is truly a wonderful and highly successful meeting.